Hi, I'm Beau Humphreys, and this is the Personal Finance Show. This is a special episode of the Personal Finance Show during the COVID-19 pandemic. There's a lot going on right now, and I haven't done a podcast episode since September 19th, 2019, so just over 6 months ago is when I took a little break. And there's a lot to update on, so I'm just going to start there. This may be a weekly thing, or maybe just a one-time update, but I feel like it's the time to come out of semi-retirement or sabbatical to talk to everybody, because everyone's in social isolation. Everything is happening from home right now. I'm working from home. I'm going to tell you a little bit about that too, what I've been doing. I think we should just go back to the start. This is going to be unedited and uncut. Basically, I'm talking until my baby wakes up. I'm watching him on the monitor right now. So baby Henry is just over a year old now. He was born on February 1st, 2019. So that's kind of what I've been doing for the last year, as well as making some podcasts for the first part of that. But about a year ago today, I was just trying to figure out how to be a new dad, a new parent. We were both able to stay home because I was still off making podcasts and trying to make money on my own, but mostly living off money that I had saved from previous years. And I decided to make weekly podcasts. I was going to continue to make podcasts weekly. As soon as the baby was a little bit older, I took a break. I set some up to run during February and March. And in April, I started up again trying to book guests and get weekly. And by September, I got to 100 episodes. So September 19th, I published my 100th episode. And then I decided to take a break. I recorded the last episode at FitCon in Washington, D.C. with some pretty great people. Then I did some training with Hoyes Michaelis for my future job, which was to be an insolvency counselor, BIA insolvency counselor. And that's what I do now, full time. At the end of September, my wife went back to medical school, so I became a full-time dad for 3 months, stay-at-home dad, which was a really great experience. I recommend all new parents. Somehow, maybe it doesn't make any sense to stay to be like the primary parent if you're the one working or if your spouse is working. Sometimes it just works out that way, but there were times when my wife was working 12-hour shifts or even 24-hour on-call rotations, and we would go and visit her at the hospital for 20 minutes during her break. So it gave me an opportunity to figure out, what it's like to be a single parent, at least temporarily, and it's tough, even just for a day to do everything yourself. I definitely don't envy single parents in that respect. Absolutely. That was enough for me to realize what it might be like to do it all the time. And having two parents is important, I think, just to be able to have some sanity, have some life of your own, perhaps, right? Just to be able to take some time for yourself. So I got to do that, and we were going to do that until we got daycare. And we ended up getting a couple of days of daycare to start part-time in December, but really we got full-time daycare in January. And that's when I completed, I had written my exam in October for the BA Insolvency Counseling, and I passed that, which is great. Doug Hoyes has been very supportive in that obviously I couldn't start work until we had daycare because, medical school is very busy, and he just knew that I was going to have some daycare set up before I started full time. Doug was patient, which was great, and I started January, and that's what I do full time now. And of course, a lot of things have changed in the last week. So, as a BIA insolvency counselor, what I do is I meet exclusively with people who have already filed for bankruptcy or a consumer proposal, with Hoyes specifically. They have to have filed with us. Hoyes Michaelis, licensed insolvency trustees. The two options for not paying 100% of your debts in Canada are bankruptcy and consumer proposal. And as some of you know listening, I filed a consumer proposal myself 11 years ago, back in 2009. So I'm obviously a big fan of the process, whether I work for a company that offers that service or not. I've been through it, so I know that it's very helpful, and it was for me. Of course, it's not the perfect option for everybody. So when somebody comes in, the trustee or an associate does an assessment and helps find the right option. I'm not going to talk that much about that and what's good and what's not. Everyone's very specific, and that's why, if you think that you need help with your debts, you really should just, go to hoyes.com, HOYES.com, and fill out the form online or give us a call, and then somebody will help point you in the right direction. Everything is free. You don't pay any money until you actually sign and start the proposal or bankruptcy. No money up front. That's a really important thing. We really don't want anyone to have to pay for a consult. Some places charge for that, and it's not right. The money comes afterwards, and the whole idea is we're supposed to reduce the amount of money that you owe or you're paying, right? That's the whole goal. So give us a call, especially right now, just to figure out what your options are. The best thing is to listen to the Debt Free in 30 podcast. I'm going to put links to the last 2 episodes, including the episode that I was on the last 3 episodes. I was on the last episode before the world turned upside down, I guess. If you are a Hamilton fan, you'll know what I'm talking about. This is really an unprecedented time that we're in, and if you're listening to this in the future, hopefully everything's not still like this. But today it's March 29th, 2020. It's early morning, so I don't even know. It could be some things have happened, more developments, but what is happening is 20,000 new cases every day, or 100,000, depending on how we're going around the world. And cases mean there's some of those are deaths as well, or the death count keeps growing as well. But what we're all doing right now is social isolation, social distancing, physical distancing, working from home. The idea is a virus can't spread if you don't get in contact with anyone. That's probably the most obvious thing to people, right? If a virus can't just sort of walk out of the door and walk down the street and go into somebody's house. I hope that there aren't any viruses like that, because that's really kind of crazy. If that was possible, I don't know if anyone would be able to avoid it at all. But for right now, we kind of have to at least be in closer than 6 feet or 2 meters or from each other to be able to transmit this kind of stuff. So we're all just trying to not do that. And one of the main things is asymptomatic carriers. So that means as someone can be totally healthy, even a baby, for example, could be totally healthy, no symptoms. And a lot of babies don't even develop really heavy symptoms, but that doesn't mean they're not carriers. So, you're just walking down the street, or you go to the grocery store with everybody who's healthy, and you meet other healthy people, and even maybe you're all going to stay really healthy, but then you all come in contact with somebody else who is not as safe from the virus as you are, and then they get really sick, right? And maybe they die. And that's the idea here, is nobody knows who has symptoms. Everyone's telling me that I think it was SARS, the last coronavirus that existed out there, that you would not be contagious until you already had symptoms or something like that. I'm not I don't know about this stuff, but it's just what I'm hearing. So like the idea is like some other viruses aren't really like the one that's happening now. You would just know you'd be sick already, and then you isolate, and so there was no chance that you pass the virus on. Well, that's a possibility for some viruses, but this one is not like that. It's like almost the opposite. You don't know that you have it, and you might not even exhibit symptoms for like 2 weeks. So you could be like hanging out with hundreds of people over that time if you're like, if you play sports or if you do any kind of group activity, and then you're passing it on to somebody else, right? We're not used to living that way. We're not used to thinking that, hey, maybe I'm contagious with this thing I don't even know that I have. And so that's why this all seems kind of, it's all really intense, because right now there's a state of emergency in my province, the province of Ontario. And that's the thing. Everything changes every day, right? Like every day feels like a week. Everything's just moving so fast. Some people are totally like social isolation, and some people are still, what's the big deal? Because we're like, it's moving so fast, nobody's really on the same page yet. And so that's why the government's trying to get us all on the same page, saying, okay, here are the actual like changes in the laws, and these are the things that you have to do. So, if you're not really sure what to do and you're listening to this today, just go check out the government sites and see what the actual rules are and try to follow those rules. I'm not going to tell you what to do. The thing about this podcast, and the reason I started it in the first place, is I just want you to have all the information that you need, financially, just to live your life. Because to live your life and take care of your finances, you have to, take care of yourself, your personal, mental health, physical health. So you're not going to be able to make money doing something if you're sick with a virus, or if you go out and spread all this stuff around and then nobody can leave and make money. Really, what's happening, one of the biggest financial thing that's happening right now is everybody's losing their jobs. I got really lucky. I joined a company in January that, funny enough, not set up to work from home at all 2 weeks ago. Not even a thing, right? Not even a concept. If anyone was like, can I work from home? Well, maybe they could make a phone call from home. Maybe that's the most they could do. But would they have access to our insolvency software, our database, our phone system? We're still working on that one. Emails, different ways to communicate internally in a secure way. Like that's the whole idea with we have a lot of information that is very, very personal. So it has to be secured in a way digitally, right? So working from home means you have to have a secure box, like a secure computer with hardline access to the internet, like a Ethernet connection, not everything over Wi-Fi, right? So like the idea there is that's not something that is really feasible unless you really have to do it. But what Doug Hoyes and Ted Michaelis decided to do as soon as right from the beginning, when we were figuring out, okay, it looks like everything's going to be shut down, they're like, okay, let's start making the arrangements. Let's see who has the capacity to work from home, who wants to, because at that point it wasn't even a mandatory thing yet. I'm talking like a week and a half ago, right? It's like everything moves so fast. But whoever felt like first of all, if you were sick, of course, you got to go home, or if you felt sick or you needed to be isolated because you were exposed to someone. But then the other thing is, if you felt uncomfortable meeting with people, which is where I was sort of at last Monday, or I guess a week ago Monday, just before, like the day before daycare closed down, and then my wife's medical school closed down, and they both, in terms of timing, got sent home at the same time, so that was good. In that, we didn't have to. I didn't have to stop working, and she didn't have to stop school to take care of the baby. It all just kind of happened that way. And I just kind of isolated in my office until we had work from home access, which still, even though the commitment was to get everybody working from home, it took some days to get it done. And then by the Wednesday or the Thursday, everybody had to work from home pretty much, or isolated in an office. But we had the ability to do so, which was really good. And so I guess a week ago Friday, I started working from home. So last week I did a whole week working from home, and then as of Tuesday, they shut down all non-essential services. And I mean the whether we're essential or not, I don't know if that was ever determined. But the idea is everybody's working from home now. That's the new reality. So I'm very lucky that I can do that. But my job is to meet with people every day, now on video, who have just filed for insolvency. And so I'm meeting some people who are in a similar position to me and that can work from home, and their income hasn't been affected, which is good because they need income right now. They don't have credit anymore. They likely don't have any savings. There's a reason why they filed, right? If they had savings, they probably used it to pay down debts earlier. or try to not come in to see us. So everybody's in a different situation, and I'm meeting with people all day, and some of them have the capacity to continue to pay and to continue to pay off their proposal or pay into their bankruptcy, and some don't anymore. And so that's what we have to kind of deal with. And so, yeah, if you're listening and you're a client, especially if you're in that situation, definitely just give us a call so we can talk about what the possibilities are. And everybody should listen to the Debt Free in 30 podcast episodes that Doug is doing, updating everybody on what to do in this situation, right? Because there's a lot of nuance here, and I'm not necessarily qualified to talk about it, but Doug is. And that's what I want everybody to do is go. There's a lot of resources out there. So like I'm going to speak about Canada, of course, because the situation in the States is really complicated, and I don't want to talk about it. But some people that are talking about it in the States are some of my good podcast colleagues. Money with Friends is a great sort of daily. I think they're doing it daily now, almost every day. It's Joe Salsihai and Bobby Rebell. Just talking about the news. Really, they pick an article and they talk about that in the morning, and I think it used to be called Money in the Morning. And Stacking Benjamins, they're doing episodes. You want to find podcasts that are like not like mine. I'm deviating from the normal method of the personal finance show, which is just telling somebody's story. That would usually be evergreen, and it doesn't matter whether we're in 2020 or 2025, right? Their money story is their money story, and what they're doing now, it doesn't really matter what year it is. But for this kind of stuff, it does matter, and the reason I'm deviating is because I want to talk about this, and I realized I have a platform for it, and I just want to talk about what I'm doing and the stuff that's out there. And I'm not here to give you any advice. I realize I'm not really here to give advice. Even in my everyday job, I'm not really telling you what to do. I'm just talking to you and giving you information, right? We're talking about what works for you, what would help you. And so the way for me to help you in this podcast is to just talk about the things that are out there that might be helpful. So that's resources like podcasts and Hoist Michaelis in terms of debt issues if you're in Ontario. The government sites, one of the ones that I like for Canada, Matthew Seawick. So he created this really good infographic. I'm going to post a link to the infographic in the show notes. And it's basically, he called it Navigating the Canada Emergency Response Benefit. Go and find that. And of course, none of this is official stuff. It's just his interpretation and of what are the options for you in Canada if you need assistance. The situation you could be in right now, there's a couple of different situations we could all be in. Number one, you're still working in the same capacity as you were before. Hopefully it was something that you could do without much contact with people, or maybe you just have no choice, or you're an essential service. If maybe you're on the front lines at a hospital, and I mean this is these are the people that are taking the highest risk, and the people that we should all be very appreciative of, because without people in hospitals, what would we do? Maybe you're one of those people, and you have no choice. So the plus side is you still have a job, you're getting paid, fine. So you don't need assistance. Maybe you're even getting extra pay and extra hours, right? I mean, there's a lot of pros and cons to this situation, but at least one of them is not no money. The other side of it is you're working from home, like me. Very lucky to be able to be isolated, but also be able to still get paid and still be able to help people and do your job. That's not everybody, right? If you work where you have to have contact with people, that's not something you can do from home. Say hair or a tattoo or any kind of cosmetic stuff, right? Like, you can't do that remotely, and a lot of it is not essential. It can wait, right? I didn't get a haircut for a year and a half in the last 2 years. Like I waited that long between haircuts. I know that it's not detrimental to your life to not get a haircut. It might make you feel better. It might make you feel like you're more you or together, or you get, that for your own style, but it's not something that we have to do to live. And that's kind of where we're at right now. It's the things that are out there. We have to make that choice. Do I need this? Do I need this to live? Is this something that is something that can wait? And so maybe you're one of those people, and now you either are, you're working for somebody and you had to be laid off, or you're self-employed and you have no business, you had to shut down. So the two options for you are employment insurance, EI in Canada, and this new Canada Emergency Response Benefit. So check out the infographic that Matthew made. Two categories. Do you qualify for employment insurance? And if you do, you probably applied already, but I think like 1 million people applied to EI in a week. So they kind of realized that's ridiculous, and the system is not set up for that. So they created this Canada Emergency Response Benefit, which, remember, all this stuff changes every day. So just everything that I'm saying, don't take it as like this is the way that it is now. And just remember, none of this stuff I'm giving you is advice. I'm just telling you where to go to look for stuff. And even Matthew's chart, it could be out of date by the time that you're listening to this. The Canada Emergency Response Benefit, it is taxable, but they were saying that they're going to deduct 10% tax off the top. Well, then I think the next day they changed that. It's going to be $2,000 you get, but you're going to pay tax on it later. And then that could change again. So the idea is you want to keep on top of all this stuff. And if you're looking at a document or a blog post or anything, or listening to a podcast like this, just make sure it's the most up to date. Like, use the podcasts and the blogs and all that stuff as a guide to learn about things, to learn about where's my starting point, and then go and find the up to date details. Or if you can call the government or ask them. I'm sure everything's overloaded, but if there's any way to determine what that is, for example, so the current information right now, the Canada Emergency Response Benefit, it's for self-employed people and contractors, and even people who qualify for EI, but the EI is taking forever and you're not on it yet. You get $2,000 a month payable for up to 4 months. The starting point is you lost some income, so you have to have lost income. Like, for example, I haven't lost any income, right? But if my wife goes back to school, or if one of us has to take time off to take care of the baby because the baby doesn't have daycare because of COVID-19, that's one of the reasons. So you lost income because you're sick, quarantined, because you actually lost your job. You have to take care of a family member or a child that is sick or home from school or daycare. Now, there's 1 billion kids home from school right now around the world. That's what I heard. It's crazy numbers, right? This is really unprecedented times. And schools are the place where these things just breed, right? And daycare, everyone's saliva is all over everybody else. They put their mouths on everything in daycare. My son's just over a year old. That's how he learns about things. It's putting things in his mouth. So if he's got COVID-19, everybody's getting it. And speaking of my baby, he is just waking up now. So this is a good place to end it for today. I'm going to put a couple of links in the show notes. I feel like this is something that I want to do every week while this is on, while we are all still at home until we get the word that we can all go out and even if we can gather in groups more than 5 people, which is not the case right now. So until then, see you later. Bye.